All right. Good morning, ladies and gentlemen. Welcome to today's session on discussing with you today how successful women political leaders have dealt with testing worldwide and how the countries that are especially led by female leaders all around the world have performed well in testing and to combat COVID-19, which allowed to reopen their societies and economies. I'm delighted with you to be with our distinguished panel here today. We have a very incredible group of women, strong women here on the panel, spanning from a global health leader, Katharina Böhme, who's leading the testing community, and our distinguished former prime ministers and the former head of the World Health Organization. We are very delighted to hear from these powerful women soon how they have combated COVID-19, what their advice is, and why do we face a global crisis on testing, and why do we need testing right now as a democratic and transparent tool to be able to treat populations correctly. At the moment, we are facing a global crisis. We have leaders such as Donald Trump, who are over the weekend calling out globally to reduce the amount of testing in order to not have high infection rates. But for a matter of fact, if we test correctly and rightly, we know the right statistics and we know how to treat our populations. So testing is what we have available today and now. And that's why we have to promote testing worldwide to the most vulnerable societies who don't have the access to tests how we would think they would. Vaccines are as equal as important as other treatments, but what we have now is testing and we have to use it. Let me introduce myself to you. I'm the executive director of the G20 Health Development Partnership. We represent a group of over 25 global health organizations from across the civil society, pharmaceutical industry, and academia. And since the creation, or since health was becoming prominent on G20 agendas in 2017, we have been pushing to see to global leaders worldwide to see health as a positive investment rather than as a challenge. Now we are at these crossroads, and the COVID-19 pandemic is showing us that global economies have been massively impacted and the implications have exceeded the problems that we have faced in the financial crisis in 2008. So let's gather together today to discuss the burden of our economies, not only in the G20, but also beyond. And let's discuss with these strong political women today how we can face this crisis and how testing is the most important tool to do so. Lastly said, don't forget, if you test, you have a democratic right, you have transparent numbers, and you hold your political leaders accountable so that they can't hide any facts. Let me take you through today's agenda. I don't want to take much of your time. We have this delighted panel that will be introduced soon to you by our great moderator, Aviva Wittenberg-Cox. And throughout this session, we will run a poll today where we will ask you various questions about how important you think testing is, how do you think are women affected by these, and what could women do to encourage more testing and combat this crisis. Lastly, we will issue a statement after this conference to seek your support. And if you want to become a testing champion, and if you want to promote the importance of testing to G20 leaders, the European Union, the United Nations, and other global organizations, we count for your support. Last but not least, as always, please don't forget to tweet throughout this session by using the hashtag #TestToExit, COVID-19, and testing champion. I would like to start the session, and I would like to introduce my co-organizers, Silvana Koch-Merin, the president of the Women Political Leaders Network, to take the floor and showcase the importance of women in this fight. Thank you.
Thank you very much for this wonderful introductory words that really put us already onto the topic and really introduced us to the very matters on behalf of women political leaders, let me welcome you all, your excellencies, dear friends, dear participants all over the world. I'm Silvana Koch-Perrin. I'm the president of Women Political Leaders, which is the global network of women who are in political office, if it's parliamentarian, ministers, prime ministers, or presidents. We all know the saying, the best time for a new beginning is now. But sometimes in times of crisis, it's quite easy to lose sight of what we can do right now. We might instead look into the future with plenty of questions, or we look back thinking about the past. However, what we do now, that's what matters, because that has the power to create this better tomorrow. Our webinar, our joint webinar here has the title Test to Exit COVID-19. Because without a vaccine, testing remains an immensely important and valuable measure against COVID-19. And the good news is we can make use of testing already now. Testing has a vital role for identifying those who have contracted the virus so that it's possible to treat them, but is also key for preventing the spread of the virus. So testing must be championed by leaders and made available to all their constituents. And for this, we need to join forces for funding, for developing innovative solutions, for increasing access to affordable and high-performing testing. Beyond access, citizens must engage in the testing process to strengthen its effectiveness. The only way this can be achieved is through collective action, because now we can build a platform to enhance the visibility of the success of women's leadership. If you just think of Angela Merkel in Germany, or Jacinda Ardern in New Zealand, Katrin Jakobsdottir in Iceland, I could go on. The list is not very long, unfortunately, because women still only make up for 7% of the world's leadership in politics. 93% of the countries are run by men, but those countries run by women have done relatively well in fighting the pandemic. And Women Political Leaders has highlighted the important work also of female parliamentarians in the COVID-19 pandemic. Have a look at our website or social media channels. So looking at the successes that women leaders in politics had for their countries in fighting the pandemic, just imagine a world where leadership would be 50-50. So one can truly say the importance of women's representation in the global response to COVID-19 is evident. And joining us in this session, in this webinar, we have parliamentarians and ministers from around 20 countries all across the world, including from Albania, Argentina, Bhutan, Bolivia, Cameroon, Canada, Lebanon, Maldives, Mexico, Montenegro, Morocco, Norway, South Africa, South Sudan, Spain, Sweden, Uganda, Ukraine, United Kingdom, and more. So a special welcome to all of you. Today's webinar provides the opportunity for women leaders as champions for the fight against COVID-19 to convene, to share ideas, needs, and solutions. Because our future lies in the collective action we take today. And it's now my great pleasure to hand over to Aviva Wittenberg-Cox, who is the CEO of 21st, the world's leading gender consultancy and a best-selling author. Aviva will moderate the event, and I'm very happy to hand over to her. Thank you.
Thank you so much, Silvana, and a delight to be here, a real honor. I am very much impressed by the power that this moment offers to collectively bring together almost 200 women leaders from around the world to address such an urgent question. So I'm delighted to facilitate. We have a panel of 4 eminent speakers I will introduce in a minute. We'll run through about 30 minutes of having them partake of their particular expertise and perspectives, and then we'll open the floor to our participants who are, as Silvana mentioned, from over 20 countries and get a really global conversation going. I find it really empowering personally to see that we are recognizing the particular contribution that women leaders might make to a pressing global problem, and to see us all reunited. So I was invited here because of an article that I wrote that was showcasing basically about 15 different women leaders in countries around the world. And I pulled out what I thought were the 4 key characteristics that distinguish their rather or relatively successful management of the COVID crisis. It was their truth-telling, their decisiveness, their use of tech, which includes, of course, testing and tracing, and love. I thought the tone and the empathy with which they were obviously motivated by a care for their populations was in very net contrast to some of the really negative and entirely male leadership that we have seen, and which is spreading. I was reading just this morning of some of the very concerning trends we're seeing both in Brazil and the US. And it's this contrast between these women who are telling the truth, acting fast and pragmatically, no fancy showcasing, no bragging, no hogging the screen, but instead really harnessing the pragmatic rollout of preventive measures to save their populations right from the very get-go. So very unsurprised to find that this initiative to roll out testing, particularly in low and middle income countries, is coming from these female voices. So let me turn and start now with the panel. I'll start with Katerina. You're the CEO of FIND, which is a reference organization for all things testing. And you're co-convening with the Global Fund, the global coronavirus response that has been launched by the G20, the WHO, and the EU. It just launched last May as part of the ACT-A Diagnostics Partnership, bringing together key stakeholders from the global diagnostic community. So, Katerina, as a scientist and the only female global health leader in the ACT Accelerator framework, can you give us a snapshot of the challenges we're facing on COVID-19 testing?
Yeah, thank you, Aviva. It's a great pleasure to be with you here today. And I think all of us on the panel here have very personal experiences also to share in the context of COVID. Mine clearly is linked to my experience both as a CEO of FIND, an international NGO, but also as a co-convener of the ACT Accelerator Diagnostic Partnership, an entity that brings together a lot of individual organizations all united in the fight against COVID-19. Thank you. Could we just have the next slide, please? So testing really has proven its value for COVID-19. There is scientific evidence that is emerging and has emerged that testing early and comprehensively clearly curbs death. We see countries like Singapore, South Korea, but also Germany, for example, have low death rates because they have started to test early and the right populations at the right scale. We also see in the meantime how important it is to test healthcare workers. And so it's really a tool that allows us not to fly blind. However, many countries, and in fact most countries today, have very low testing rates. In Africa, for example, in DRC Congo, the testing rates really remain very low, with about 400 tests conducted a day. Not sufficient to know where we are in the epidemic or to implement the much needed test, trace, and isolate strategies. Going forward, testing will remain absolutely critical to detect hotspots, to avoid that we face even more profound economic impacts and are able to target our interventions. But testing will also be the foundation for the introduction of new treatments in test and treat strategies, as well as the introduction of vaccines, where it's going to be absolutely critical to know the zero prevalence in the country and in a given setting. Next slide. So the diagnostic partnership with FIND as a co-convener, and also with my other co-convener, Global Fund, and I'm sure that some of the Global Fund team today is with us here on the call, you know, are driving forward as a partnership to address COVID-19. But we're doing so in the absence so far of a lot of funding, and I'll come to the massive gaps that we face as a testing community. And what we see out there is really, we see first of all a supply chain war. Access to testing remains limited. Access to the right testing is oftentimes not possible. We don't have much needed rapid diagnostic tests. So our diagnostic partnership really addresses COVID-19 through an end-to-end approach. We work on innovation, R&D, all the way down to implementation of the tools and working with countries to strengthen testing capacity. Next slide. And this is what we want to deliver in the next 12 months with the overall 6 billion that we put forward in our investment case as a partnership. And you know, I won't go here through the commitments that we make in terms of deliverables, but I think what is most important to state is that in the end, it's very important to focus on the impact. And so what we set out for is that a significant number of low middle income countries have been supported to put in place effective test, trace and isolate strategies, and that we've minimized together the disruption of core health services. You know, importantly, and a lot of us on the phone, I'm sure, have engaged or are engaging in fighting other epidemics, such as AIDS, TB, and malaria. From these epidemics, we know that testing combined with strong health systems and engaged communities is a very effective tool for surveillance, but also to ensure that the most vulnerable can be reached. And that testing strategies have proven to be very effective for these epidemics. Community health workers in this context are really vital for the deployment of effective testing programs, which is the ultimate goal here. And many community healthcare workers are women and play a key role in educating populations. And that's why it's a particular pleasure for me to be part of this event with women leaders, but also, for example, with Annette, who speaks on behalf of these healthcare workers and nurses. Next slide. You know, we are embarking a next period of pledging for the ACT Accelerator partnership with a highlight event on the 27th of June. As many of you may know, so far the diagnostic partnership has only achieved 2.5% of the funding we need, which is really a shame, because as my previous speakers have commented, testing is something we need to do now to halt the spread of COVID-19, and it's all we have right now. Next slide. Many of you may have read about successes on the treatment side, where, for example, dexamethasone looks promising. And we've also heard about promising results from the vaccine research and development front. However, you know, dexamethasone is not a drug that would be introduced as a symptomatic treatment. It needs testing. And likewise, vaccine need diagnostics as a basis for rollout. So we have a very critical and short window of opportunity now to make testing available to countries, to scale up testing, so this is the time to act, which is why we're here with you today. Thank you.
Great, thank you, Katarina. So yeah, very, very clear that a lot of attention and money is flowing over to vaccines. You can certainly see that in the media coverage. Vaccine, everybody is absolutely running for a vaccine, which isn't coming anytime soon. So this urgency of what can we do today, and your invitation to really focus now on testing as the only way to protect our populations, which is a very good opener to turn to Dr. Brundtland now, who is a medical doctor by training, who served in all kinds of capacities as Norway's Prime Minister, as the Director General of the WHO. You chaired the World Commission on Environment and Development, but now you co-chair the Global Preparedness Monitoring Board, which conducted a first analysis of the needs for vaccines, treatments, and diagnostics. So you're particularly well positioned. What's your take on this pandemic and how nations have responded so far? And how can we improve global cooperation and create a strengthened mechanism to combat future pandemics?
Good morning, and thank you so much, all of you. First of all, let me say I do applaud the FIND initiative, as testing worldwide will be vital for our ability to limit and contain the enormous humanitarian and economic fallout of the COVID-19 pandemic. Testing is now the most important medical technology to limit the spread. And it is, of course, essential to make contact tracing and isolation efforts effective in fighting every outbreak. Testing will be crucial to the rollout of both vaccines and treatments once they become available, hopefully. Indeed, already early March, the Global Preparedness Monitoring Board analyzed and mapped out the needs for urgent investments in vaccines, treatments, and diagnostics, a sum of $8 billion. Our call to leaders went to G20 and to G7, and we have been in contact with the leaders of both the World Bank and the IMF. The generally positive response to our initiative, also led by the EU presidency, was very important, although more funds are still necessary and gaps need to be filled. Still, when we observe the much too limited investment in testing, even today, we really have to call upon all political leaders to understand and to act forcefully in the regard, with regard to testing itself. We see many examples of not fully understanding the implications and maybe protesting against evidence. We are all aware that finding a vaccine is crucial, but even then, to be able to roll out vaccination programs, we will need testing to establish who needs the vaccine and to prioritize limited stocks globally. With regard to any new treatment, the same applies. Treatment will depend on a diagnostic test as well. So we all need to be prepared also for new moves of COVID-19 outbreak and new waves coming up. And of course, in a longer term principle for the next pandemic as well. We need to work together. That's the main message. No one is safe until everyone is safe. Our health systems and our economies are challenged, and challenged seriously. global solidarity is the only workable option. The experience of supply chain crisis and a battle for accessing test material is already a lesson learned. We must do better for the benefit of us all. So concrete global action is what we now need. Justice, global coordination, and global allocation, and the efforts to make them happen based upon agreed principles is necessary, that in order for us to get this right. And what we can see now is that many of our institutions across the board will need to prepare in a different way for the next outbreak. We already have seen the weaknesses in our existing system, from the international health regulations to the systems of the IMF and the World Bank, and the way that we are set up to work effectively together. So thank you for the initiative, and good luck with much better results than what we have seen so far. Thank you.
Thank you, Dr. Brundtland. I certainly take away no one is safe until everyone is. Absolutely, and a call to do better next time. I would invite all of you listening to use the Q&A section if you'd like to submit questions by chat. We will be taking them up as we go along. And I'd like to then turn for next intervention to Dr. Aminata Touré. Ms. Touré, you've served as Prime Minister of Senegal. You're currently President of the Economic, Social, and Environmental Council of Senegal. And with all your experience, also within the UNFPA. So we want to thank you first for serving as Goodwill Ambassador to FIND and the ACT-A Diagnostic Partnership as a champion for testing. How has Senegal managed its preparedness and response to COVID-19? What's been the role of testing strategies in your country?
Well, first of all, thank you very much. And I am very happy to serve as the Goodwill Ambassador, FIND, for testing. I like to bring my greeting to all my co-panelists. As for Senegal, and maybe I can extend even the analysis to West Africa, we are satisfied that the first assessment that we heard that Africa would, lose millions of people didn't occur. So that is the first thing we are satisfied with. I think it came out as, this virus being very unknown. And but what I can say from Senegal is that at the very early stage, we took, I do believe, the right decision. When it came to closing the borders, making sure that we limit the moves between different parts of the country, quite isolating the capital, that is the center of the, of COVID-19. And a lot of measures that were taken sort of helped a lot to contain the spread of the disease. There's been a state emergency right from the start. The closing of the border occurred even before, northern countries did so. So I think the government of Senegal sort of acted ahead of time, and I think that would help sort of contain the epidemic. We have now, about 70 casualties in a country of almost 16 million. But at the same time, we do have some concern because we have to have an analysis in the long run, but for sure, we are not in the same place as what we have observed in Europe for different reasons that I hope the researchers will be able to analyze and share with everyone. The country of Senegal, let me remember, is young. 70% of the population, as for the rest of the continent, by the way, is below the age of 35. So it brings some good news, but at the same time, it is very difficult, as you may know, to handle a population that young, that tend to be outside, and we are seeing it, worldwide. And that is something we need to think about in terms of specific strategies. When it comes to Senegal and to the continent as a whole, I like to say that it is very, very, very important that we involve communities, because when it comes to testing, there are a lot of resistance. Unfortunately, some very high-level people issued information about testing, making bad example between COVID-19 and HIV, how we should test any vaccine in some vulnerable population. So that really create, first of all, an outrage, because that was some scientists issuing those statements. And what it has created, it made our work more difficult. So now the communities are very reluctant when you talk about testing or whatever comes from outside. They see it as something that can be harmful to them. And we have to acknowledge also that some I call it misstatement about limiting the population of Africa doesn't help neither. Many communities would say, well, it's not a test that you're coming with. You're trying to limit the population. What's going to happen if we take the test? Are we going to be sterilized? So this is a heavy heritage inherited from, very unfortunate statement, and somehow statement that I would let's talk about racist. And there is a lawsuit going on in France about those kind of statements. So that doesn't help. So it complicated the programs. So my forte here is, first of all, testing is vital if you want to handle COVID-19 properly. I do have a personal experience from very close member of my family who went through it. And luckily they recovered, but I could see how from the beginning testing would have helped the situation. One of them went to the emergency room. Luckily, they saved his life, but it could have been otherwise. So testing for me is the first step if you want to know whether you're suffering from malaria, you're suffering from the flu, and then the care can be very precise. For me, it's the first step to handle this pandemic. Secondly, so I'm talking about and making sure that the communities understand what testing means, that it is not harmful, and respecting, of course, the human right, because there's been a history of research that were not following the ethical guidelines. So whatever program we would like to put in place, and I really wish that we will have affordable testing in Africa, you have to make sure that that program work hand in hand with ethics committees and go with them at the community level to make them understand that this is not harmful. On the contrary, this is something that we look forward to make a good diagnostic. But that is not a given. I would like to really emphasize that point. But unluckily, that's what happened at the beginning of the pandemic. Some very, very unfortunate statement that came and really complicated the situation. And we have also to fight against those stigmas, so the community can come and support those programs. Second point, the COVID-19 is coming, and add to the list, the long list of diseases that are, in the hands of the health system that is not as strong as we would like to. So when we heard, when I say we, that's decision makers, that's the population, that maybe millions of people might die, all the resources, the health system resources shifted to handle COVID-19, which explained the good result. But on the other hand, you do have some diseases now that are becoming neglected diseases, which is something that can roll back results that we had built and worked for many, many years. We have a lot of cases of people with high hypertension or people with diabetes, complication of diabetes. When they go to the regular health system, the resources are no longer there because they have shifted to COVID-19. So COVID-19 is coming as an additional burden to an already overloaded health system in Africa. And this is something that we need to think about to make sure that at the same time, all other diseases are taken care of, and testing can help. Because if you have the test that is decentralized at the community health level, then immediately you know what you have to conduct in terms of medication. And you save time at the same time, which allowed also the health system to sort of also deal with other challenges. So that is important because testing, to my views, will bring more balance in terms of resource allocation, because now whoever is coughing and comes with a little fever is supposed to have COVID. So, and that's not necessarily the case. That's most of the time, that's even not the case. And now we are going toward the raining season here in Senegal. So you will have some malaria coming up, etc. So we are kind of tense about how we're going to sort out these things. And testing, as we had it, when it comes to malaria, we can immediately, when testing became affordable, treat, because having time to treat is vital to save lives. So for me, it's a very, 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 very important strategies to make sure that testing is affordable first and accessible and decentralized, because that's what we are facing now. We do have 2 testing centers, and of course, it's not enough. By the time you come to the other part of the country, bring it and making sure that that person is positive or not, you may be treating something else, but you're not treating COVID. So testing has to be really decentralized all the way to community-based health services if we want it to be effective, and if we want to really respect the human rights of everybody and making sure that it's affordable, especially bringing it to reproductive health services. That's where women go when they're pregnant, or even when they are sick, because that's where they used to go. When they have malaria or whatever they have, they go to the reproductive health services. So it has to be there. And lastly, it is important that we build the resources, the internal resources, national. In Senegal, there's been some researches about testing, and it's important that that gets supported. So we can have also what I call build a sovereignty, medical sovereignty. That's important. The resources are here. Maybe it can be regionally based, not necessarily, producing tests in every single African countries, but by hub. And I do believe that the resources are here. So it is time for solidarity. I do think it is time for building national and internal resilience, which we have been doing. As we speak, the borders are closed, so you cannot come in and out. And still, I do think that we manage quite well. So the health system has to be really strengthened, and it has proven its resilience. So it has to be supported in terms of resources, in terms of research. And we count on our coalition to make the advocacy for that. I think it's also an opportunity for Africa to sort of build internal resources and be self-reliant, because at the end of the day, that's what matters. Because over the 3 months when the pandemic struck, everybody left and went home. So we were left with our own resources, national resources, to handle the pandemic. And I think we did quite well, but we don't brag, because the time is also long. We don't want a pandemic that become chronic. We want to get rid of it very quickly. And for that, we need testing as the first tool. I think that's the first line of defense. And it's very important that we make testing affordable, make community understand that it's safe. That I cannot stress.
Dr. Toure, may I just interrupt for questions of time, because I think you're showcasing a very successful strategy that really did work by very early response and containment. A really interesting and important point on the ethical dimension of how this testing is perceived by local populations, and then how do you sustain this in a much more systematic measure. So thank you for Senegal as a role model to many other countries in the world, and absolutely we were expecting Africa to not have such strong statistics. So I hope it's not just because you have a young population, but also because you have some very smart leadership in action.
Yes.
Might I turn now to Your Excellency Amira El Fadil, because you've served as the Minister of Welfare and Social Security in Sudan. So we're going to Sudan, the Minister for Social Affairs for the Khartoum State Government. You're also a Member of Parliament. Today, you're Social Affairs Commissioner for the African Union. So thank you for being here. As a world leader specializing on social development, children and women and girls empowerment, how do you see Africa's response to COVID-19 testing and the future? And we have a question from the audience as well, is there a difference between men and women being tested and having access to testing?
Thank you very much. Assalamu alaikum, and greetings from Addis Ababa, from the headquarters of the African Union. And thank you for all the organizers and the co-panelists in this very important meeting, and all the participants. And you mentioned at the beginning that we have 200 women in this meeting. And thank you also for focusing on women leadership amid this COVID-19 crisis. And us in the African Union, we are 10 elected officials. 5 out of the 10 are women. So we have our parity on the political level. I'm the leading commissioner on health issues, but my colleagues, the other 4 female commissioners, also they are working according to their mandates also as part of the fight against COVID-19. We convened meetings for women, ministers of foreign affairs. Also, we convened meetings for women ministers of gender. In my area, ministers of health, the women ministers of health also, they are participating and acting actively. I wanted to make these comments before going into my statements to appreciate that we as African women leaders, we are playing a significant role in fighting COVID-19. And also we are very much aware about the role of the women in winning this fight. And when I say the role of the women, I'm not excluding the thousands of women, female workers that are part of this fight. Plus, of course, the women politicians, whether they are in the governments or in the parliaments, or even working as women leaders among their political parties, or leading women's civil society organizations. I thank you again for giving me this opportunity to participate on behalf of the African Union Commission. I would like just to say that today, our statistics today in Africa, it says that the number of the infected cases is 306,000. The deaths is 8,115. The recovery is 146,000. This is the situation according to Africa Center for Disease Control and Prevention statistics of today. So that means the risk is very high still in Africa, and the numbers are increasing every day in the continent. What we did as an African Union, that 1 week after the first case reported in Africa, the first case in Egypt on the 14th of February, 1 week after, we convened our emergency meeting of the Ministers of Health of Africa. And I think we have acted very quickly. because we were watching, even before having the first infected case, we were watching what happened in China, and even we issued a motion of support to China from our heads of states and governments. And we were expecting that it will come to Africa, because we know the mobility of the people around the world and even within the continent. So the first thing we did is we approved in that emergency meeting, and we invited also WHO to be part of the meeting, the Director General and the Regional Director for Africa, they were part of the meeting. We approved our joint continental strategy on COVID-19 in Africa. I think this is now what we are implementing, what we are following the implementation with our member states and with our RECs, the regional economic communities. It is the strategic framework we adopted, and we are implementing all of us together. And from the beginning, our heads of states and governments, they agreed that Africa will act together, not as individual countries. It will act together and in solidarity and in unity. And they accepted also the technical leadership of Africa CDC, which is the technical body within the African Union Commission. I would like also to share with you a brief preview of the African context when it comes to COVID-19, more details. I mentioned the figures, I don't want to mention it again, but in Africa, six countries alone, out of the figures I mentioned, 6 countries alone, they have represent approximately 73% of all reported cases of COVID-19. As you know, we have 55 member states in Africa, but 73% of the affected cases are only in 6 countries of Africa. 80% of the countries reporting less than 5% cases. This is the situation we have in Africa.
So a very heavy concentration of
yes, in 6 countries.
Challenges in 6 countries.
By the name, but 6 countries are bearing the 73% of these infections.
Right.
So address the challenges we have. The African Union has worked proactively and tirelessly to consult with subject matter experts and stakeholders to develop meaningful partnerships. Earlier this month, we rolled out the partnerships to accelerate COVID-19 testing in Africa, also known as PACT. And I agree with all the previous presenters that testing is the way out of this COVID-19.
So one of the questions from our audience is from Robert Yates, who's the Director of Global Health at Chatham House. Do you think that all the diagnostic tests for COVID should be made available to everyone free of charge?
Yes, I do. Yes, I do. Yes, I do. And this is our initiative in the African Union. The chairperson launched an initiative called PACT. PACT is a partnership to accelerate testing in Africa. It's about testing, tracing, and treatment. Our first target was 10 million. Then we raised up the target to 20 million. Then we negotiated with our member states that every country should at least test 1% of the population. And this test, it has to be free, because if not free, it will not be affordable, it will not be accessible to everybody. And there is no discrimination in the testing between men and women. I think this is one of the questions. There is no discrimination between men and women.
Same degree of access. Yep.
We have launched this PACT initiative, and today the report I received in my office that 3.8 million tests were conducted in our member states out of the first target, which is 10 million. We are also following up. We have mechanisms also to follow up on the testing, and we are encouraging member states to do more and more testing, to test and to isolate the infected cases. Because as I said, till today, there is no vaccine. Till today, there is no agreement on the treatment itself. People are using different protocols of treatment in different countries, but there is no one protocol, there is no one medicine that's approved by WHO, agreed upon and licensed, and no. So that's mean our only way out for out of this COVID-19 is to test and test and test and test, and to isolate the infected people, and to make sure that we will minimize the number of transmissions in the continent. This is our main
Okay, so
initiative.
thank you.
I'm sorry if I took long, but
Not at all. Thank you so much.
there is a lot to be shared. There is a lot
There's
to
a
be
lot to be
shared.
shared, and it's a very big.
But I consider myself a champion for testing.
You
because of
certainly
my
are
background
making a
and,
very strong case for testing. So I think
thank you.
between the three panelists we've had so far, if anybody out there remains unconvinced, I don't
Just
know how
one point to share, if you excuse me, one point. We have a shortage of medical supplies in the continent. Unfortunately, we don't produce locally most of these items needed to fight COVID-19. That's why we have created with the private sector of Africa a medical supplies procurement platform. Okay. It is shared. It's a public-private platform, an electronic application. We negotiated with manufacturers around the world. We negotiated even the prices, and we are supporting member states to purchase their requirements throughout this platform out of the pool procurement, which is agreed by our member states. So this is one of the gaps we have in Africa, and we are trying to fill this gap by producing or proposing solutions. Sorry for having the floor again.
Not at all, and you've just responded to one of the questions from the floor of what are we doing to respond to work with the private sector to produce the diagnostic tools. So let me turn now from the testing policy and organization to the front lines and the healthcare workers who are doing much of this. And I'm going to turn to Annette Kennedy. Thank you for joining us. You're the president of the International Council of Nurses, and you've served as commissioner on the WHO Independent High-Level Commission on Non-Communicable Diseases. So you really are the front line of the global health workforce. And the majority of this is female, as we well know. In this COVID-19 epidemic, how do you see the role of nurses, one in testing, but also the paramount importance of the safety of for nurses and other healthcare workers of being able to access this testing themselves? Welcome, Annette. Thank you for being here.
Thank you very much for the introduction, and thank you for having me here. This is a most important topic, and particularly for the people that I represent. And just to give you a little bit of background, the International Council of Nurses represents 20 million nurses across the globe in over 130 countries. And they are on the front line. They, and whatever I say, represents all healthcare workers. So we have become very concerned about what is happening in relation to the number of nurses and the number of healthcare workers that are becoming infected with COVID-19 and in actual fact dying. And, you know, when we heard from Italy and Spain and heard that nurses were actually committing suicide, it was very, very serious. So what we have been calling for, we've been calling for governments to prioritize testing for healthcare workers, for frontline workers, to have regular testing for frontline workers. It's not happening. We want comprehensive surveillance and data collection from all governments, from all countries, and that would be reported to WHO. That should be a priority, because unless we know the actual numbers of healthcare workers being infected, unless we can trace, unless we can find out why they're being infected, we cannot prevent further transmission of the virus. And that is very serious, because nurses particularly, they are 60% of the health workforce. They provide 80 to 90% of the hands-on care. So they are the closest. They spend 12 to 14 hours a day with the patients. And we were trying to find out a little bit more about how many nurses were being infected. So, and it's difficult. So we took 30 countries that we had an idea that had fairly good information. And what we found was that there was a variety of ranges of statistics among the nurses that were being infected. And it went from 1% to 30%. So leaving out the outliers and indicating that you take somewhere below the average, which may be 10 or 11%, and you take 7%. You take 7% of the number of people that are affected globally, which is over 8 million. So you're saying in effect that more than 500,000 nurses, just nurses, I'm not talking about total healthcare workers, I'm just talking about nurses, are infected with COVID-19. Many of them will be quite ill and many of them will die. So even going further than that and saying that of the general population of those infected, 3.5% die. So going very low on that and saying that maybe they won't have underlying conditions and maybe they're not older people, but even going as low as 0.5% or 1%, you are talking about thousands of nurses dying. We are 6 million nurses short. When COVID-19 started, every country started calling in retired nurses, nurses that had been on part-time work, nurses that were in just finishing their training. They were calling them into work. So we are short. How can we afford to lose even one nurse? And I call on governments because they have a duty of care. They have a duty of care to the people that are going in and providing their lives to curb the infectious disease of COVID-19. It's a deadly virus. And I agree with our previous speaker who said that there isn't protective equipment. There isn't. We talked to our colleagues on Friday in Latin America and Africa, and we were told that even masks and gloves and protective equipment was not available for them. And we were expecting them to go into their death. And it's not right. So at the very least, they have to have surveillance, they have to have regular testing of COVID-19. That's the least that we expect them to get. So I am all for this, and I'm certainly for being a champion of COVID-19 testing. And I would also like to say that other people have said that there has been a lot of neglected other conditions like vaccinations. And we know that. We know that there's well over 2 million children in Africa that haven't been vaccinated for measles and for other childhood conditions. That's not appropriate either. So when you talk about how the women in the different countries have done, and as you said, nurses are by majority women, and we think in terms of prevention. That's all we think in terms of prevention. And you start with prevention. You don't start with treatment. But what we have seen in many countries is people started thinking about hospitals, beds, ventilators, but they didn't think about how do we prevent it going across? Who are the most people that are at risk, which are the older people, the people on the front line, and those is where we start. But did they go into long-term care? No. Those were the last places we saw them going in. And those are the people that should have been tested first and foremost. So if you ask me, am I passionate about this? Yes, I am.
We know you're passionate. We can hear that.
We need to protect the people who are delivering the care.
Yeah.
If we don't, you won't have a health service. And I suppose tired of hearing about economies and, you know, what will happen to the economy. You won't have an economy if you don't have healthy people. End of story.
Yeah. A question for you, Annette, from the floor, from Rachel Hammonds. Any country offer a good example of testing of healthcare workforce? Anyone we can look for?
That's hard to tell because the countries that have done well are the countries that have prevented, I suppose, much of the infection. And you will see that with, as you say, Singapore, you will see that in New Zealand, you will see that in Taiwan, you will see that in Korea. You will, you know, and those are the countries that we know that have done the best because they've gone into prevention first.
Right, right. Okay. Thank you. So a call to action and really a danger zone from, so I think we have a pretty unanimous and very aligned panel. I'd like to open it up a little bit to the floor. We have some questions here. I'd like to bring them in live, if I may. Jamie Nishi, who is the Director of Global Health Technology Coalition. Are you there? Would you like to unmute and give us a question to the panel?
Sure. Hi, can you hear me okay?
Yeah, I can hear you just fine. We can't see you, but we can hear you.
I don't see the video button, so maybe I'll just stay on audio here. But yeah, thank you so much. And going back a few speakers, again, thank you to everyone this morning or this afternoon who've given your comments and contributions. We agree that investment in R&D and advancing the diagnostics piece of COVID response is absolutely critical. And I wanted to circle back on some comments. I think Dr. Brundtland had touched upon this earlier, but talking about the global mechanisms for countries to strengthen their diagnostics capacity. So thinking about the global mechanisms, you know, if we're looking at product development capabilities, quality assured manufacturing, laboratory capacity, and distribution needs, do we need to look at, for example, the WHO's international health regulations and see if they need to be modified for better inclusion of medical countermeasures, including diagnostics? I know that also Senegal plays a really important leadership role in the global health security agenda, and I was curious if we need to be pushing on the GHSA to focus more on this. And then what more can we do to even motivate the G20 leaders to really jointly come together in solidarity and contribute to the diagnostics effort and mobilize resources for this huge gap in terms of COVID response? Thank you.
Pretty broad questions. Thank you, Jamie. That's 3 of them, I think. I'll invite the panel to take which one they want. Perhaps, Annette, you want to start?
It's difficult to answer the whole comprehensive list of questions that were asked.
Just pick one. Okay.
Well, we have been asking the G20, that's for sure. We have been writing to the G20 on 2 accounts. One is on protection in relation to protective equipment, because that's the most important for our people going into COVID-19. And we have been asking about surveillance in relation to infection control. We need that. You know, when I look at it, health is a human right, but it's a human right for nurses and for health workers as well as it is for everybody else. So that's what we need badly. But there have been a lot of good examples of looking after or preventing COVID-19 from transferring across countries. So we can look at what has happened across country. There has been quite a number of very good examples about them getting into prevention and getting into control and stopping the actual people coming into the countries, cutting down, stopping very early on. And that has worked. It has worked very well for the countries. Other people just, I suppose, waited a little bit longer to see, would it happen or would it not happen? I think one of the things that I would say is that we all waited too long. We did know it was coming. We didn't believe it was coming. It's happened in other countries. It's happened as pandemics in other countries. So nobody believed that it was going to cross the world. Well, it did. A small virus brought the country and the world to its knees. And I think we have to learn from it.
Yeah, and absolutely. Dr. Torre, you probably want to add something, and I might add, just to combine with another question from the floor, that the G20 Health and Finance Ministers are meeting in September to discuss a more resilient response to COVID and future pandemics. Do you have any?
Thank you very much. Yes, I like to also look at the others. Part of the equation. Of course, testing is the first line of defense, but we also have to go a little bit further, because we are testing, and in case of positivity, we want to bring the proper medicine. And when it comes to Africa, it brings the whole issue about faith medicine. A lot of people are going to do research and new medicine are going to come in, but we have also to put that also into perspective, that according to some research, 30% of the medicine that people are using are not proper. So I don't think COVID-19 is going to be an exception. If it comes with medicine also, you will have criminal minds that are just going to take the opportunity. So while we are discussing about treatment and testing, and including testing, let's make sure that we don't have fake testing either. So that is part of the equation, at least here in the continent, part where I am, which is West Africa. So that is important. I do think that solidarity means also supporting internal initiatives when it comes to creating testing locally. And we do have here some research going on, and I think it's very important that we become self-reliant when it comes to testing in the continent and in Africa. So that is a strong point that will require resources to support all these research centers that are very active. So it becomes, as I said, also my reference point was malaria. When we brought testing for malaria and made it affordable, I think it contributed a lot in decreasing the number of deaths from malaria. So that is also the point I wanted to make related to fake medicine. So that we have to anticipate on that to make sure that proper medicine will be brought, but also to make sure that proper testing tools that are not fake, but that are real, that are affordable, will also be available to the population.
Thank you very much. So I'm going to
just a quick comment from me. This is Katrina.
Please.
So I just want to say that I fully agree with Jamie that that strengthening testing capacities and health security matter, and that needs to be reflected in global regulations, and would be very helpful. And then on the point of Ms. Toure on regionalizing supplies for diagnostics, that is absolutely key, right? We've seen that, we've seen the weaknesses of having just one or two diagnostic players globally for many of the test needs. And so regionalizing production, ensuring that there is testing production capacity in Africa is a key goal of the ACTA partnership. And in fact, we'll have a call for proposals on that subject shortly.
So no fake news, no fake testing, no ignoring of nurses, and we're all in this together is what I'm hearing from the panel. We're running out of time. I'd like to perhaps, if I may, take one more question before I hand back to you, Katarina. Sana Fournier-Wendes, who's the Chief of Staff of Unitaid. Are you here online? Would you like to unmute and submit before we close? One last question.
Hi, can you hear me?
We can, thank you.
Hi, good afternoon, everyone, and thank you very much for giving me the opportunity to speak. I've listened with a lot of interest to this and realizing and just want to echo all of the support that we have in terms of until everyone is safe, none of us are safe, as well as the critical role that diagnostics will play within this area and bringing this strategy forward. So Unitaid is a global health organization working specifically on ensuring equitable access to new health products, and we're a strong partner and supporter of the ACTA partnerships. And notably on the topic that we're talking about today, Unitaid, together with FIND, the Global Fund, and many other actors, is actively involved in the diagnostics partnership. So we're very much part of these discussions, and we're co-leading on the work on the therapeutics. So diagnostics are absolutely key, but I was wondering maybe a question that could be asked to Katarina or to some of the others, and I think we've alluded to it here, is the very strong need and focus on affordable access and equitable access. And so many of these tools, as we've seen and as we see with vaccines and we see around the therapeutics, is a certain level of hoarding of these technologies as soon as we see something that does become a potential, which really jeopardizes the notion of equitable access at a global level. So I was wondering whether we could speak a bit about how to ensure the equitable access, but also an adapted access. And by that, I mean that we need tools at all levels of the health systems that are adapted and are able to be responding to the needs of the populations at all of those levels. So I was wondering if panel members had thoughts on how we can make sure and help to work with manufacturers and researchers to make these products adaptable as well as affordable. Thank you very much.
Thank you, Sane. Katarina, you want to perhaps take a jab at that, and then I'm afraid we're going to have to wrap it up. So I'll let you both answer and perhaps conclude.
Yeah, so thank you so much. And you know, Sanne, as Ms. Toure also highlighted, she's our Goodwill Ambassador for affordable testing, which already suggests that that's not something we have in our hands today. The PCR-based tests out there are relatively expensive, but also complex to use. And they will only be usable at more centralized levels of the health testing. I think the most transformational test that we need is a test, you know, an antigen rapid diagnostic test available for $1. And that's where we will focus a lot of the R&D funding that ACTA-DX has in its hands today. To make sure that that will happen, we need market interventions, and that's of course where UNITAID's role also is going to be very critical. We're working on mechanisms, you know, similar to an advanced market commitment. And as Sanne said, this will not be trivial because we're in a clear, this is a clear seller's market. And so it's going to be important that we all use our joint forces to negotiate pricing, to negotiate access, especially also for low middle income countries. And so pooling procurement, working together to drive equitable access is absolutely key for the partnership. Thank you very much. With this, you know, can I just have the closing slide up? Could I ask the organizers to
yes,
have the closing slide? And Hatice, I think, you know, I let you take over. You know, again, I think it was a great pleasure to have all of you. You know, we really want to re-emphasize the call to action to make testing happen now. You know, and within the next days, we will send you, all of you, a statement that we hope that you, either in your individual capacity or your capacity, you know, or on behalf of your organizations and institutions, can sign off to work with the ACTA-DX partnership, to work with all of us to make testing a reality for all those who need it. Thank you very much.
Can't agree more with you, Katarina. Thank you for the distinguished speakers. We have compiled a call to action to all international organizations, the G20, ahead of their meeting in September between health and finance ministers. And we surely think that everyone who joined this call today, including our distinguished speakers, have we would like to get your feedback on our call to action, which we will send to you. And if you are devoting yourself as a testing champion, we will share with you a form in this chat very soon that you can sign on to, and we will send you further information how you can become a testing champion. And Aviva, on to you for your final remarks.
I just want to say how inspiring it is to hear you all pushing these agendas in your respective countries. All of you sharing your opinions through the polls. I can tell you that you've voted overwhelmingly for the fact that the role of political leaders in this COVID crisis is absolutely key, and that you think testing is absolutely key, but you think the information going to communities and the solutions being provided are not at all meeting the test. So I think this call to action and the fact that you've all gathered together and this invitation to sign this call to action and get directly involved as a group should have huge influence. As I say, the timing is very good with this meeting in September of the G20 finance ministers. It's when the rubber hits the road, and this kind of influential group should really be able to up the volume. So thank you all for participating. Thank you again, even more, for signing and signing up to the call for action. I can remind you perhaps to hashtag it. The hashtags for the session and for the call to action are test to exit, testing champion and COVID-19. Thank you to all our very distinguished speakers. It was a delight to be with you. You're an inspiring and empowering group onwards to help save the world from this pandemic.
Thank you. We look forward to working with all of you.
Absolutely.
Thank you.
Yeah, everyone.
Thank you very much. Thank you.
Thank you.
Thank you all.
Thank you. Thank you.
Thank you.
Thank
Bye-bye.
you.